Okay, it's just a minute past the hour. I'm excited to get started. Welcome, everybody. We're really excited to have you all here. And I just want to start by saying thank you. I know you all are taking time out of your busy day and schedule and spending it with us, and we appreciate that. Just a bit of housekeeping. We are going to do a Q&A towards the end of the presentation. So throughout it, don't hesitate to put any questions you have in the little Q&A section of your Zoom. And as you all know, you're here today to chat through the nurse career and satisfaction survey that Trusted did. And I'd like to start it off by just providing a little bit of context on why we did this. And so historically, if you look at the nurse career path, it takes a pretty linear progression. You have a nurse starting their career and climbing the clinical ladder, and oftentimes staying at the same facility or health system and potentially even the same specialty throughout that career. And if you look really at the last 5, certainly the last 10 years, and absolutely exacerbated by the pandemic, that is changing in a rapid way. And so that's what we're here to find out. We wanted to understand why, and understanding why allows us to make some of the adjustments that all of us need to make in order to push the profession in the right direction. So we're excited to have you and looking forward to diving in. All right, so with that said, I'd like to just quickly introduce the star of the show and my co-host, Dr. Courtney Caulfield. She is a doctorally prepared executive nurse leader with a focus in informatics and operations and the CNO at Providence St. Joseph Health. So Courtney, thanks for joining me and welcome.
Thank you so much, Matt. It's a pleasure to be here, and I'm very passionate about this topic, and I'm so excited to get to share the information with everybody and get some great feedback. Thank you so much.
Yeah, thank you. And for those of you who don't know me, my name is Matt Pierce. I'm the co-founder and president here at Trusted Health. I've spent my entire career really focused on staffing, labor economics, and how to solve some of the challenges within those industries with technology. So we think we've got quite the dynamic duo here between Courtney and myself, and excited to share. All right, so what are we presenting and who was the sample in which we surveyed? So the survey was conducted by nearly 3,500 nurses late last year. So we sent out an email and asked for responses and got an overwhelming number of responses. 54% of those nurses were actually travel nurses, 37% were staff, and 9% were in per diem or other types of nursing roles. To dive a little bit further in the demographics here, as you can see, the top specialties represented were acute care, critical care, and emergency. We have a nice even distribution of tenure among those surveyed, with 22% being 3 years or less and 28% being 10 years plus, with an even distribution there in the middle, and a really nice correlation to what the industry shows as far as the gender breakdown. So 88% women and the remainder men. All right, so with that said, we will dive in. One of the things we wanted to understand, and we've certainly seen here in the pandemic, is why nurses are taking a travel nursing contract. And, you know, I could certainly read each one of these. I'm not going to do that. Each of you will have the report. We're going to email it out afterwards. But I just want to share some observations when kind of combing through the data. And one of the things that I found super interesting and would like to maybe chat on a little bit or have some discussion around was this cluster toward the mid or the bottom of it, right? And specifically, we see ability to work in different kinds of hospitals or clinics, the solution for boredom, stagnation, or desire for more variety in jobs, the ability to gain new nursing skills. And we have respectively 45%, and 55% of nurses, you know, indicated that was the reason. And one of the things I just found really interesting was this seems like an opportunity and low-hanging fruit for health systems, healthcare facilities to provide that within their current environment and current atmosphere through a variety of different ways, in which might mitigate some of the loss of their staff nurses transitioning to travel. And I just found that to be, really interesting. And I'll just point out one more thing, which 17% of the nurses we surveyed said nothing would make them take a full-time role, which one, I found that to be really high. But two, the flip side of it is we've got, 83% of nurses who've taken travel roles have an opportunity to come back to a staff nursing role. And those are, really interesting numbers. And I think would certainly, help some of the ways we think about, fulfilling our shifts and mitigating some of the staffing challenges that we have. Courtney, I'd love to either have you expand upon some of my observations or point out anything that was interesting to you as you kind of comb through this.
Yeah, thanks, Matt. I was reading through this information. I mean, great study. I know a lot of people will want to use this information to help make their case as well in the future. So I haven't seen one that really dove into why travel nursing and what can we do about it. The desire to avoid unit or hospital politics, when they say culture eats strategy, for breakfast or whatever, that really, the morale in organizations, I know it's in the middle of the pack there, but that stood out to me where there's the things and then there's the people and how you feel about an organization or how you feel about your leader when you're there usually keeps you one way or another. So that stood out to me a little bit. And I think without that emotional connection or maybe a dramatic environment that you don't feel connected with, if you were teetering one way or another, I've heard from a few people that they said, I'll just go ahead and try something different to see, what's out there as well. But other things on this list that stood out to me are things that if employers are looking to try to retrain staff, a lot of things in here are controllable. Some things aren't, but looking at that as an opportunity.
Yeah, curious to you. When I saw the desire to avoid unit or hospital politics, I kind of put those in two buckets, and I'm interested to hear your thoughts. And this could be just completely wrong, but those buckets were, to me, the actual kind of how we treat our new nurses or existing nurses. I've often heard when chatting with nurses eat their young. And that's a little graphic, but it's just something that stuck out in my head in conversations that I've had. And then the other bucket being the bureaucracy of getting things done or feeling that their voice is heard. And I just wanted to see if you thought that there were other categories or if that resonated with you, what your thoughts were there.
Yeah, no, absolutely. And I do think you hit it on the head where, you think the old school way was, fend for yourself, good luck, here's a hard assignment, let's see if you survive. I do see more preceptors, seasoned nurses saying, give us some help. If people are coming to help us, we want to help nurture them because we need you to stay. Because I don't have to work then double overtime because I have a team. But how that some organizations I think are further along the line in not accepting, a bullying or a hostile work environment, things like that. So it really is that, that's why it hit me because it's milled down the road about, I'm going to step away from this drama, whatever it may be, or I'm not as engaged. I'm going to go try something else. And I know I've heard, anecdotally that sometimes the grass isn't always greener, as well. And you realize, when you have a great team. Something else that stood out to me on here, I mean, everything does, but just variety, stagnation, learning skills. But one thing I think that we've heard loud and clear is this is a odd time in history. So, why not try something a little bit obscure, a little different? And it's not as taboo to say, I want to work somewhere else, or I want to try this other city, or I want to go on an adventure. And it's okay to be a little bit unstable, which may correlate also with travel nursing and giving them, those opportunities to have downtime and really take care of themselves.
Certainly. Yeah, I think what's interesting is a little bit of the power shift from the health system, health facility to the nurse, and the pandemic really kind of putting a magnifying glass on that. Them knowing that, at the end of the day, they're in extremely high demand. And if they want to go try their hand in something else, they're going to do that. And so if the health system, if the healthcare facility doesn't truly show an appreciation and an investment in those nurses, that's exactly what they're going to do. And so yeah, really interesting components here. Let's dive into the next one, Courtney.
Yeah. So I'll start off this section here and want to go through, like you said, we won't go through everything, but it is a little bit smaller here. So the next section here about percentage of nurses who agree with the following statements. I miss out on important events. The way holidays and paid time off schedule negatively affects my overall job satisfaction, current scheduling, lower satisfaction, and I wish I could work more days but less hours. So maybe alternative work schedules, which may not be the thing of the past anymore. And so I think a good point is noted here where nurses are looking for more control over schedules, control over what they do have power to give input into. And I like the statistic there saying that, your experience would be better if you had a little bit more control. Schedule usually comes up quite a bit. And my experience working in union and non-union and contract and non-contract facilities, sometimes as a leader, it ties your hands. You're like, I want to do this, but I can't. So how do we creatively either work with our organizations, partners, staff, or think, okay, what can we do? And if you do have the autonomy to be able to do that, put the power in the hands, of the staff who otherwise might be able to pick and choose travel shifts as well.
Yeah. One of the things that popped to the top of my head was the conscious or subconscious belief that giving the nurse more control in their schedule has a negative correlation with shift fulfillment. And we've found that to not be true. And a bit of a shameless plug, but one of the new products that we have is Trusted Works, which is a platform that really solves this issue. And I bring it up because the nurse side technology that we released is an app which really allows intelligent shift distribution for nurses to receive open shift notifications based on their preferences. So they set their preferences and only will they receive a notification if it falls within those parameters. And what we found is a much greater participation rate in in incentive shifts and the overall shift fulfillment rate. And so this is just one component on like, what are your tools? What are your systems? What are your processes on empowering the nurse, which I think also has a positive effect on taking some of the work off of the nurse manager or the staffing office, because the nurse is actually picking those up on their own. And then also the positive correlation with, empowering a nurse to actual more shifts being filled, more participation rate across the board. So really found this to be interesting. And, some of it is, leaders' hands are just tied behind their back. They want to empower the nurse, but, what tools, what technology do they have to do it? And it's tough. It's really challenging out there. So.
Yeah. And one other thing I noticed on here, the largest percentage on here who agree with the following statement: I miss out on important events because I can't get time off. And you would assume, well, you work 3 days a week. How do you not have time off? You have vacation time. And what I've heard from multiple staff, a gentleman named Oscar came to me and said, but we can't take time right now because I'll feel like I'm ditching out on my team. I'm letting people down. And I talked to a nurse named Michaela, who's very passionate about this as well, and said, when we are all told you have to hold the unit together to the frontline staff, you feel that sense of, oh my gosh, it's us and we have to do that. They need you to help us during these hard times. But, how do you maintain being who you are and taking care of yourself to be able to come back another day? So, when you're already working overtime, how do you, even if you were offered the day off, how do you say no when you feel like you're really committed and part of a team? And I think that has been loudly shared from multiple people. And I see that on here. And one strategy, not to give an answer to the quiz or anything like that, but, when I'm talking to people who I consider innovative leaders, what have you done? What can we do? And again, if it's in your power, can you do creative blocks of time off? Can you do, go on a walkabout, go, come home, go in and explore and come home. When people are out on leaves, I had a nurse share that they feel so guilty. They have an accident, an injury where they can't come to work. They want to help their team. And so nurses in my opinion, they're in it for the right reasons, for the majority, and they want to help their team. And that's where I read a lot of this. I miss out on important events. It's not just they won't approve your vacation. It's the guilt of I have to be there for my team and we are in crisis. And I feel for everybody because I feel like the crisis has been more than a marathon now.
Yeah, this reminds me of our Not a Hero But a Human campaign, and nurses feel like they have to be a hero, and
Yes.
that is really challenging 2 years into this pandemic. Not to mention they have that outside of the pandemic as well, and so I think it's really important to address this as something nurse leaders talk to their nurses about, and understanding their, even though there might be guilt, and even though in the past we have inserted that guilt upon you, and maybe subconsciously, that's really, we need to think about mental health, physical health, and really the 360 view on longevity, engagement, and retention when it comes to our nurses. So yeah, this is a great point. As we look to the next component here, we wanted to find out what were the top reasons nurses aren't interested in leadership roles. One of the things I just want to point out right away that kind of blew my mind is that 1 in 10 nurses define that a successful career, included leadership within their career path, and that's just something that we have to change. And is a big component of the success of the future of really the whole care delivery picture. And some of the things I wanted to point out, once again, just some observations. Unlike the last one, there's quite a few pieces of feedback here, but towards the bottom, we have not enough training support offered for leadership, or no leadership options have been discussed. And I think that those are really low-hanging fruit items where should be table stakes that healthcare facilities, health systems ensure that they're communicating what the leadership path is for nurses, who they go and talk to, where are the resources at. That's a huge component. If we can expand that pool by 5, 7, 12%, that's a big number. That's a meaningful number, and seemingly is something that's in all of our control on just communicating the path and the options that nurses have for leadership. The last thing I'll point out before kicking it over to you, Courtney, was just believe that leadership spends too much time on staffing and scheduling. I've talked to countless nurse managers who are so fed up with this component of it. And it circles back to some of the points we made previously, but how do we allow nurse leaders to focus on empowering and enabling their staff, and focusing on care delivery at large, and not get bogged down and in the weeds of staffing and scheduling and kind of the monotony of that. And just super interesting feedback here, and would love to kick it over to you, Courtney, and hear your thoughts amongst all these different components.
It's funny you start with that one, because we heard scheduling as well with staff. It's like, look, we're doing it. But, I had a nurse manager named Elaine, and she said to me, for the love of God, let healthcare keep up with technology. And there's got to be a better way to do this than an Excel spreadsheet. And, that is where, from a leadership perspective, sometimes you walk into technology that is so far behind the times that you have to do it in order to staff appropriately. But there's such a better way to do it. And it's frustrating, because where do we want to be? We want to be out there in the front lines. We want to be out there rounding on our staff, not behind a door. But then you have the wants and the wishes of parts of leadership. And I did have a leader, great leader. Her name is Amy, and she came in and said, I didn't really want to be in leadership because I see you guys, the paperwork, I see what you have to do. How is that fun? And you have to think in leadership that you're able to help take care of the patient in a different way. And seeing the senior nurses who are leaving to travel, some of the younger nurses are saying, well, why would I step up into a leadership role and take on that additional responsibility? I want to leave it at the door because I need to protect my time. So, how do you make leadership fun? I mean, I love it. I think it's
Yeah.
great. But not everybody has the same, mental, what brings you joy. So looking
Yeah.
for the opportunity to, as many of these states in here, help people, help bring back what people need to patient care. And we want leaders to be leaders, as stated, and we want to lead. And you didn't go into this to, be a bookkeeper. But also people don't plan on going into management. It just kind of happens sometimes as you have skill sets and you identify people, or in my case, having the second item down there, maybe having a poor leadership and saying, I can do that better than them. Let me help fix this. And
Yeah.
then, hey, you're the manager. So I think that for the staff, for leaders out there, for people who want to be in leadership, for those of you listening who are in leadership, just know we hear you, we see you. There is more people in the same bucket than not who are dealing with all of these, not only staffing challenges, but leadership staffing challenges. So really trying to say, why would I not only keep a staff at a hospital, why do I keep a leader in leadership? What brings joy to you? So, and not only just offering options to them, but really making it, empowering. And nursing specifically, you working for an organization that values the nursing voice, and it has a seat at the table, and words in the decision makes a huge difference. So I just wanted to share that.
Yeah. One of the things, I mean, when we look at the top here, we see nursing, politics, and culture being 66% of respondents. And I found this to be really interesting. And a lot of it ties back to our previous conversation we were having with nurses, which is, there needs to be nurse managers, CNOs, nurse leaders across the board need to lead by example when we talk about, some sort of work-life balance. And that need to feel like a hero certainly comes from leadership downwards. And I know a lot of nurse leaders who aren't able to, leave it at the door and are constantly on. And we know providing care, it doesn't stop, right? It's 24/7. And so it's easy to get drawn into that. But, to not realize you're setting an example for all those nurses and really impacting your pipeline for nurse leaders to come up because they're seeing you always on and feeling like that is unattainable or something that they're not interested in. There really has to be, empowerment for nurse leaders to feel like they can, leave it at the door to a certain extent. And that certainly impacts the pipeline for those to come after you all.
Absolutely. Well, and I think that when you use the word leader, traditionally, does that mean charge nurse? Does that mean manager? Does it mean a chief nurse, director? Nurses lead their patients' plan of care every day. They are leaders and have leadership qualities that maybe they may not realize. And somewhere in their pathway, if they're determined that, hey, I think that, my end game is going to be, I want to be this role. Seeking out a mentor. I have a great mentor in Pam and a lady named Bonnie that have helped me thinking about, what do you want to be when you grow up? I just still don't know, and it's okay for everybody on, who are listening to this. You may be feeling the same way, but it's getting somebody who will help your skills develop. Not just that this role needs to be filled. You're not just the placeholder, you're a leader, and whatever title that ends up being. I think it's a great end game. Depending on what you desire to do as well. In addition to that, I did notice that, on this survey as well, only 6% say they plan to move into nursing leadership. And this is a current survey. So I wonder, in the past, if maybe there was more desire and less opportunities. And potentially now we still have the same job descriptions that say must have, oh, you don't check the box and have 4 years acute care experience, bye. And it's like the best leader you've ever met. So I think as employers, you really have to, hire for karma, teach skill, and set people up for success. And I have seen hospitals really stepping up their game a little bit more that way, because you're hiring the people who are going to be there with you in a crisis, as we've all learned.
Yeah. One of the things that just came to me that is a challenge across all industries, I'm curious to get your perspective on, is we have a tendency to elevate the highest performer at an individual contributor level to leadership and management. And that certainly isn't always the best fit or the best case. And I'm curious if you feel like that happens within nursing, and if so, why? Is that, something that should be discussed, should be addressed?
Yeah, I think to kind of answer the question in a way is that the pipeline is there. There are people who need to have a chance taken on them, and said to them, I believe in you, and there is a desire there to lead or not. But I have found that, especially right now, over a handful at least of 1 to 2 year experienced nurses have said, I want to lead, I want to help, but why would you pick me? You can't be a charge nurse till 1 year, or I need 10 years before I go to the ICU. And so you really do need somebody who doesn't have a background in that area to help identify what do you need to be successful, and take a chance on them. And then once you give them that experience, even if it's a little taste, and this can apply to, going to critical care, going into leadership, going into surgical services, give an opportunity to see a little taste of the job in addition to leadership, and then help develop them. And then they have the, responsibility to pay it forward. And I've seen that circle itself over and over again, where you believe in somebody and say, okay, your responsibility in doing this, your to do is now to pay it forward and identify somebody else. It's not succession planning, it's developing each other.
Yeah, absolutely. Super interesting. All right, so we're going to transition into some recommendations we've received from a variety of different nursing leaders, and this certainly isn't comprehensive. We just picked out a few, and would love to have some discussion here on some potential recommendations on some of the challenges we just uncovered. Recommendation 1 would be reinvent nursing career paths. And just I'll add a little bit of color here, and then we'll kick it over to you, Courtney. One of the things that we saw and what we heard in the survey was the desire for flexibility, for autonomy, for different locations, different specialties, different care settings. And those were the reasons why nurses were moving to become travelers. And I think when we think about the options that health systems or facilities have, is creating those things like rotational programs, whether it be with, other facilities within the system, or a partner system in which gives exposure and allows nurses to expand on their skill set, to have a change of scenery, to broaden their experience. Those are certainly things that might be a challenge in the short term to change status quo, but will, I think, have a return on investment that is certainly worth it in the long term. We also think about, expanding upon your float pool and creating a robust float pool program. So those are some of the conversations we've had when thinking about kind of reinventing career paths. And just wanted to provide some examples of, different conversations we've had in the past on this particular category. Would love to hear your thoughts, Courtney.
Yeah. And I was just talking to somebody about this the other day, because, a lot of organizations are focusing on new grads right now, trying to redevelop their workforce. But, everybody says, how do we retain them? And I says, well, why are they leaving? And why would they, if their long-term intent is not to be in the position you hire them into, why not offer them that opportunity? One idea was to, you hire a critical care nurse in as a new grad, but they have a career path. They hire into a med surg position with the commitment to meeting their goals, but then you have a spot in ICU, or you have a spot in an area that maybe you cannot get into. And even for our current nurses, rather than leaving to get an opportunity for training in another area, then give it to them at home, and you can start it from higher, but you need to know what's important to them, and commit to the people who are with you before you go. I think what I've heard is reaching out externally to bring in the talent. You have your talent. Other career paths, nursing is not brick and mortar anymore. From my IT side and heart, informatics I love absolutely. And that doesn't mean just what did you work and build a EMR system? Well, no, there's more than that. You see innovation pop-ups, you see hackathons, but we have a lot of remote work now doing case management, social work. People sometimes agree with that, don't agree with that, nursing calls, a lot of telehealth boom. We need everybody. And so if that would be something that brings you joy, you can use your skills. And also something about, being able to have a better work-life balance, that could be a nursing career path. And it may come full circle and bring you back to the medical center at a time, or ambulatory. But again, working with HR partners as well to say, can I look at the job description and take out all these barriers? Because this is blocking great people. But the career path, when you get into nursing, I think asking maybe new grads today, what do you want to see your path, and what do you see your leadership, or what do you see your career as? We might hear something very different than we've heard in the past, and we just really need to listen and show the plethora of all the opportunities that are out there. And I only touched on a little bit.
Yeah. One of the things that's interesting is when I first saw the way that this was worded, which was reinventing nursing career paths. I think the pandemic actually pushed this kind of forward in a really meaningful way. Innovation often comes during times of crisis, and there is certainly, growth in nursing career paths has certainly transpired over the course of the last 2 years. And part of this circles back to what we talked about earlier, is just simply maybe starting with communicating and educating our nurses on what the different career paths are. Understanding what are the new and innovative ways in which care delivery is being conducted, everything from, as you mentioned, telemedicine to remote patient monitoring to home health. How are nurses engaged in those different ways and different settings, and what interests them based on their desires. And for your own hospital or health system, I'm sure it increases the chance of retaining them if you're having those conversations early and often, rather than them exploring those opportunities outside of the system. So just some interesting stuff there. Just moving on to the next one, we talked about this quite a bit, but rethinking shift scheduling, staffing, coordination. Courtney, would love to hear your thoughts here.
Yeah, and I think we touched on it a little bit, and I'm looking forward to reading some of the Q&A as well and hear from people. But shift scheduling, taking it out of the hands of, this is what you must do. And again, there are environments where the leader's hands are tied if it's something they don't have control over. But, saying, if this is what you want, advocate for it, and helping support, staff to say, this is what's important to me. But looking through, I saw a comment in there. One of the data points was people working more days, less hours, going back to the 8-hour shifts, going to, like in the emergency department, usually there's, different start times as well. Thinking about throughput in the hospital, the people who have the answers are the front line saying, well, I know why we're clogged up at 4 p.m. I could tell you, do we have enough staff at that time? Do we have the right pendulum of staff when we need that, in order to also ensure you do get to eat, you do take your breaks, you do get to leave on time. Obviously that has not been the norm in the last 2 years, but when we're talking about shift scheduling, moving it from black and white into something creative, I think is where we need help. And again, back to the technology aspect of it, there's so much easier and better ways to do things. including allowing staff to feel comfortable and being able to pick up extra shifts when they want and know where the needs really are. Because that is just, it's so much time dumped into something that can be so much simpler as well.
Totally. One of the first things we think about when we think about this particular problem is step one is actually just being able to gather the data. So understanding who's picking up the shifts, when they're picking them up, why, what are you paying for? Is it the right clinician? So one, enhancing your capability to just be able to gather the data. And then two, being able to analyze that data to understand where your biggest gaps are, why you have them, adjust your hiring plans accordingly. Some of the things that I was blown away when really entering this industry is looking at incentives that we've created for nurses to pick up shifts and how misaligned those incentives are from what the health system wants versus what the nurse wants. One like tactical example I could give is the longer a nurse waits to pick up a shift, the more they get paid. So when you look at the incentives behind that, they're going to wait until the last minute. They, based on the supply and demand imbalance, there's always going to be shifts that they can pick up. Of course, they're going to wait to the last minute to pick them up so then they can get paid the most. And that's not good for anybody. I think it might be short-term good for the nurse because they're making, a little bit more money, but it's misaligned incentives across the board. And of course, increases the cost and I think lowers the overall care quality, that's being produced. And so those are some of like the foundations when I think about, just kind of starting from scratch and rethinking this challenge from a first principles perspective. Do we have the data? Are we analyzing the data? And are incentives aligned between, all parties involved? And so I know those are big kind of bold questions, but certainly, a first principles way of thinking about, this problem and solving it.
Well, Matt, you said something that caught me, I'm looking at the screen here and I'm seeing the word trusted, and I know it's the brand, the organization, the brand, but that bid war, and the negotiation, the bartering. I've been on both sides of it, on the leadership side and on the staff side, and it's like, you also lose trust of the process, and that, how can you trust that a system and organization has their stuff together if they are, we're bartering, a penny here, a penny there, and then it's inequitable upon, I'm going to pay more for this type of nurse, or I'm going to pay more for, this shift or this and that. And between teammates, is everybody getting an equal opportunity to earn and, keep it equitable? It shouldn't be this hard. And let's make it easier, be transparent, say, here's what it is. There is overtime needs, but back to, one of the comments from somebody that I had spoken with regarding, that guilt of you're consistently, you have to pull us through and work this overtime. Here's how much it's going to be paid. But the second person, who holds out makes a little bit more. So I think, like, to your point, going back to a good solid schedule with predictive analytics in it, in there, whether it's a hiring or flex, and like you said, creative float pools. Float pools, we've seen really great success with, experienced leaders, new grads, and great opportunity of way to make sometimes a little bit more money or new skills. And so again, it goes back to thinking creatively, but asking people, what do you want? And if they don't know, because they've only been at one place, talk to your peers, give them a pipeline to say what's working well in other organizations. And again, it goes back to that trust and leadership that, we want you to be successsul, and even just as a nurse, but for the organization, for the patient care, but you as a human first. Yeah,
certainly. All right. So the last recommendation we have is just introducing better incentives for leadership. And would love to, as our nurse leader on the call, would love to hear your thoughts here.
Oh yeah. Well, and again, incentives for leadership, what going back to the locking yourself in a closet, why would I do that to myself? But I think I'll approach this in two ways. First, from leaders, some of the things that I've seen, and a comment from a nurse named Michaela has said that some organizations have stepped up the game and catch up with perks like employee gyms, massage chairs, actually ensuring and solidifying time away as a break. Sometimes social events, mental health support. I've seen some great things that some organizations are already doing. But they're also, Target may be ahead of us in healthcare, by just doing creative things. And so the healthcare industry knows that, as the most trusted profession and such important role, treat us with respect that we deserve. And then when you see that in a leadership team, or when you see that in an organization, I think it does encourage people to go into leadership. I want to be part of the solution. I want to be able to help more people from this other aspect and help create change. So, introducing, as a leader, here's some of the decisions that I get to influence, get to make, or I'm part of a group decision. And it's not just the A-type personalities that have control issues. It is people who want to help make change and are willing to take that step. But again, walking into that role, I think we owe it to the nursing profession to be able to step in and say, this is what a role of nurse leader can look like. Protecting your time, alternate schedules, telecommuting, not running out the door, hiding at 4 p.m. Sure. The badge of honor of being there. I work 16 hours, I work 17 hours. Well, goodness sakes, we're never going to get anywhere.
Yeah.
I think that being a good example, which is always very hard because there is never going to be enough time to get the sticky notes off your desk. You have to set a good example and then show people it's okay, and and celebrate what the things and help prioritize.
Yeah. One of the things that I found super interesting is searching for any sort of like tangible data on what turnover at the nurse leadership level does to a health system, a health facility, and how it impacts them at a larger scale. And it's really tough to find. And I think really diving into that and understanding what is the cost to replacing nurse leadership and what impact it has on your actual staff on an engagement and retention perspective. And so that cost then starts to extrapolate quite a bit. And I think by starting there, it allows administration to understand how much they should invest in nurse leadership and how much it means to invest in it. Because if they retain nurse leadership, then the return on investment is there. And I'm not sure that we've really figured that equation out, or there's something that administration can point to say, hey, this ROI makes sense for me to invest more in nurse managers, nurse directors, charge nurses, CNOs. And I think, it's easy for me to point out the problem. I think what we're trying to do here at Trusted is, not only identify the problem, but, really try and help solve it. But that's something that, I've been searching for, and it's been challenging to find, and would love to, be a part of the solution here.
Yeah. Ditto.
Awesome.
Yeah. And I do want to say, one thing about wrapping up this part and what you just shared is I think that there's a great appreciation for just talking about this subject and the topic. When it first caught my eye, when we were starting to talk about this, and thank you so much for the opportunity to be the clinical nurse on the call, but the reason people are leaving for travel and the people exiting from leadership, really there's a lot of aligned similarities there. And so it's just that back to, I'm looking for something that brings me joy and I can sustain. People are tired, so let's help them out.
Love it. Well, thank you. So just quickly, I wanted to introduce Trusted. I realize we haven't done that. So if you're just on the call for the nurse satisfaction survey and don't want to hear any of this, feel free to drop off, but did want to take the opportunity to introduce Trusted and what we're all about. Trusted's a healthcare staffing platform really focused on solving a lot of the challenges we've talked about today. We've been around for about 5 years. We have about 325 employees. We're headquartered in San Francisco, although Now all of us are all over the world, working remotely for the most part. We work with about 5,000, just under 5,000 healthcare facilities across every state. It's been an exciting journey for us. When we approached this problem at the very beginning, this is, Courtney, it's interesting, you kind of mentioned this. It's like in every other aspect of life, we have technology that seems to drive transparency, convenience, cost, quality control. And when we first entered this space, we were like, why the hell isn't this in healthcare staffing? This is, arguably the most important piece of our society at large, especially when we talk about the overall macro trends we're facing right now. And so we really feel like over the last 5 years, we've positioned ourselves to modernize healthcare staffing technology the way that we've seen technology modernize so many other spaces. One of the things I mentioned was Trusted Works, which is a product and platform we've released last year. And this product is specifically for healthcare facilities, and it's for them to take a comprehensive view at staffing and the challenges we face. And we think that looking at it on trying to optimize in an order of operations, your internal staff, transition into, per diem internal, float pool, then transition into per diem external and agency per diem, and then ultimately travelers. You really need to take a comprehensive view and approach. We think each of those buckets are necessary to get the care delivery job done, but a lot of technologies or companies are really only looking at one of those things in a silo, and all of a sudden you have many tools on your tool belt and it becomes challenging and confusing. And so Works is a platform that really tries to solve the staffing challenges and lock arms with healthcare leaders in a comprehensive way to get the job done. I just wanted to take a deeper dive in some of an example of how this works. So Works will plug into your current scheduling system, will extract the open shifts that aren't filled in the schedule that's already created, and algorithmically and intelligently distribute those shifts in the right order of operations to the different layers of workers that you have. And those layers are on staff unit, then maybe transitioning to float pool, internal PRN, external, then your incentive shifts, then ultimately travel. And we think that right now that's very fragmented and that order of operations isn't executed on appropriately. And on the other side, we have an app that nurses download that allows them to consider their preferences and their desires within this whole equation. And we just think that that's really important. And one of our partners, Mercy, has experienced the fruits of this technology. They have 11% reduction in premium spend, 25% reduction in workforce operations headcount, and 33% improvement upon participation in incentive shifts. So wanted to share that with you. And certainly, you're going to find out more about it. We'll shoot you over the presentation, the slides. And if anybody wants to learn more, they certainly can reach out to me. So with that being said, I'd love to just pass it over to Hiroku to maybe talk through some of the Q&A that we got throughout the presentation.
Hi, yes, this is Hiroko. So some questions I'm going to read out. Okay, first one is, do you think that travelers will come back to staff roles as the pandemic winds down?
I have my thoughts. Courtney, go ahead and kick us off here.
I'm gonna say gambling here. I'm gonna say 60%. I think that the taste of it and some of the autonomy it brings is going to be something too much that people won't want to give up just and keep adventuring and maybe not have a set place. But I do think the remainder may have realized, maybe the grass isn't greener. I need that stability and I want a long-term home and value a team environment where they're part of something a little bit more. So that's my gut, Matt.
Yeah. I'm gonna cop out on this answer and say it depends. And what I mean by that is some of the discussion that we've had throughout. And what I'll tell you is that travel nurses don't like changing employers every 3 or 6 months. being dependent on whether one agency has the opportunity that they're looking for versus another. They have to, so there's some, things about being a travel nurse that nurses don't necessarily love. They love the consistency from an employment perspective. But as we've talked about, they really appreciate flexibility, autonomy, control, diversity of care settings, specialty, learning. And so I think it depends on a health facility and a health system's ability to create those dynamics within their own system. And so if you think about building your own rotational program, your own internal travel, program, expanding upon your float pool, kind of empowering nurses to, get the components of being a travel nurse that they love, but doing so within inside the facility or the system at large, that's how and when they're going to come back. And so I took the easy road and say it depends, but just to point out one data point, which is 17% said they wouldn't come back. And that gives us, ballpark 83% to, really work with there. And so Courtney, I don't think you're too far off from your guess. But yeah, Hiroku, what's the next one?
Yeah, so this question kind of goes back. Why do you feel 1 in 10 believe success in nursing career involves a role in administration? Wouldn't we want more nurses to believe a successful career does not require that?
Interesting.
Yeah.
Yeah. I think it's a great question. Maybe I'll try and kick it off here. I think it's important to have both. And I think the challenge here is that there's a lack of communication on to the nursing population at large on what are the leadership opportunities, why should you be interested in nursing leadership, and what a nurse needs to have and what they desire if they're going to be in nursing leadership. So a lot of people are just kind of approaching it with a big question mark. And as Courtney had alluded to, a lot of them fall into it kind of accidentally. Like I've heard that so many times when having conversations, and some of that organic transition into leadership is really good. But I think all of us would want it to be a little bit more pointed and a little bit more, a decision that nurses make based on having the information at their fingertips. So I think there needs to, of course, be a distribution of nurses that are interested in leadership roles, and a percentage of that just are comfortable and confident and interested in being the nurse and the individual contributor. But right now that just seems a bit lopsided. We probably want that percentage to be a little bit higher. And knowing that a certain percentage of them aren't the right fit or are not going to make it down that leadership or management path.
Yeah. And I would just, the only thing I'd add to that, because I know we want to get through a couple more questions, is that leadership is not just being the manager. If you want to do something outside of the bedside, there is a plethora that we need to expose and make sure that people know are available things that may really be interesting to them.
It's a great call.
Thanks.
Okay, just one other question. This is regarding Works. Does the Works platform actually do the scheduling?
Yeah, great question. So it has components of scheduling built into it. So the short answer would be yes, but the more nuanced answer would be what we find most often is the case is we actually integrate into your existing scheduling. And so we allow healthcare facilities and health systems to keep their scheduling system as the source of truth. So the staffing officer, nurse managers aren't having to work out of multiple different screens, tools, technologies. It extracts the open shifts out of the current scheduling system, distributes those shifts appropriately and intelligently based on an algorithm that we mutually come up with, and then replaces the shift fulfillment back into the scheduling system. One of the things that we've really tried to focus on is all of the different, the staffing office and nurse leaders already have too many tools, systems, processes that they're having to work with. We didn't want to introduce another one. And so we felt like being able to integrate in and out of the system of record of the scheduling system was an important dynamic in our solution. And something we continue to push forward. Awesome.
Okay, I think that's all the questions. If you guys have any more questions, you can always reach out to us. I think Matt has the contact info in the next slide.
Yeah. So with that said, this is wrapping it up. I can't thank you enough. Courtney, you're awesome. You're the best co-host. I couldn't do it without you. So thank you so
Thanks,
much. And if any of you want to learn more about what we're up to, don't hesitate to either go to, as it's specific to Works, you can go to works.ai. If you want more broadly Trusted Health, feel free to just go to trustedhealth.com. Don't hesitate to email me directly. And then we're also, for all the attendees, we're going to follow up with the study and the slides for this. So more to come. And once again, thanks so much for taking the time out of your day and spending it with us. Take care.
Thank you so much, everybody. Have a great day.